Okay, starting with renal assessments and reviewing some definitions. Anuria means no urine. Cystectomy, surgical removal of all or part of the urinary bladder. Dysuria, painful urination. Hematuria, blood in urine. Nephrectomy, surgical removal of a kidney. Nephrosis refers to non-inflammatory nephropathy. Nephrosis is any degenerative disease of the renal tubules. Nocturia, nighttime urination. Safety factor would be leave a light on for the patient so that they can find the bathroom. Oliguria, low output of urine. Polyuria, frequent urination. Renal lithiasis. Kidney stones are also known as renal lithiasis and are small hard deposits that form inside the kidneys. The stones are made of mineral and acid salts. The simple description of the renin-angiotensin-aldosterone system is that the kidney detects a reduction in circulating sodium levels and releases renin. Renin is a hormone and an enzyme that chops the end off of angiotensinogen, a circulating plasma peptide, and creates angiotensin 1. Angiotensin 1 is acted on by angiotensin converting enzyme that's found mainly in the lungs, which chops off another bit to make angiotensin 2. Angiotensin 2 acts on the adrenal cortex to stimulate the release of aldosterone, and aldosterone stimulates sodium retention. Aldosterone increases sodium retention by stimulating transcription of the genes that encode the sodium pump. More pumps, more sodium retention. What makes things a lot more complicated are the additional function of angiotensin 2. This is an extremely active substance. In addition to causing angiotensin release, angiotensin 2 constricts arterioles and systemic vascular resistance, which in turn increases blood pressure and arterial pressure. Stimulates the pituitary to release antidiuretic hormone, stimulates thirst centers in the brain, enhances sympathetic adrenergic function by facilitating norepinephrine release and inhibiting norepinephrine reuptake by nerve endings, increases the strength of the heartbeat, and just about all the actions of angiotensin 2 have the effect of increasing blood pressure. Kidney assessment. If you look here, the kidneys are protected by the abdominal organs, ribs, and muscles of the back, and may not be palpable under normal circumstances. Costovertebral angle. This percussion of the kidneys help assess pain or tenderness. Assist the patient to a sitting position and stand behind them. For indirect percussion, place the palm of your non-dominant hand over the costovertebral angle. Strike this area with the ulnar surface of your dominant hand, curled into a fist. For direct percussion, also strike the area over the costovertebral angle with the ulnar surface of your dominant hand, curled in a fist. Repeat the technique for the other kidney. You should do percussion of the kidneys with only enough force so the patient feels a gentle thud. Percussion is usually done at the end of the assessment. Costovertebral angle offers protection of the kidneys by the ribs and muscles of the back. Having pain in this area could signify the presence of diseases such as pyelonephritis or kidney stones. One of the most important reasons to check for tenderness at the costovertebral angle is to distinguish between pyelonephritis and urinary tract infections. Pyelonephritis, which involves inflammation and infection of the kidney itself, is often caused by the spread of bacteria from outside the body up the urinary tract, through the bladder, into the kidneys. As a result, simple urinary tract infection affecting the bladder could eventually cause pyelonephritis if not treated, whereas having a urinary infection does not cause costovertebral angle tenderness, pyelonephritis does. Hand positioning for Crude's maneuver. This is used to help empty the bladder for patients with overflow incontinence, a method for expressing urine by pressing the hand on the bladder, especially a paralyzed bladder. Manual pressure on the lower abdominal wall is in an attempt to better eliminate the urine, and this is best performed by using both hands, leaning forward, and pressing down firmly on the lower abdomen between the umbilicus and the pubic bone. Kegel exercises strengthen the pelvic floor muscles which support the uterus, bladder, small intestine, and rectum. Kegels have been shown in studies to be effective and useful for stress incontinence. Kegels have also been shown in studies to be effective for many men who struggle with premature ejaculation. Kegel exercises for men can strengthen the pelvic floor muscles which support the bladder and bowel and affect sexual function. Many factors can weaken the pelvic floor muscles, including the surgical removal of the prostate and conditions like diabetes or an overactive bladder. Men benefit if they have urinary or fecal incontinence or dribble after urination, usually after they've left the toilet. So by doing Kegel exercises regularly, they can expect results such as less frequent urine leakage within a few weeks to a few months. The difference between a brewery and a thrill. You feel a thrill, you listen for a brewery. Lightly place a warm diaphragm of the stethoscope on the abdomen and listen for bowel sounds, normal, increased, decreased, or absence. And you'll also listen for aortic, iliac, renal, hepatic, and splenic breweries. The presence of a brewery may indicate problems such as renal artery tortuosity or abdominal aortic aneurysm. A brewery is a sound created by turbulent blood flow in an artery. Thrills are palpable vibrations felt when there is turbulent blood flow through the heart or in the blood vessel. Incomplete bladder emptying. Feeling the bladder is not empty right after urination is incomplete emptying. This sensation can increase if anticholinergic medication is being taken. Incomplete emptying is a concern because if urine accumulates in the bladder, bacteria will grow and there's an increased risk of infection. Scheduling toileting program or a toileting schedule is considered behavioral training. Overflow incontinence occurs when the patient is unable to completely empty the bladder, which leads to overflow and leaks out unexpectedly. Stress incontinence is losing urine without meaning to during physical activity, such as coughing, sneezing, laughing, or exercise. Stress incontinence is also different from urge incontinence, which is the unintentional loss of urine caused by the bladder muscle contracting, usually associated with the sense of urgency. Patients with functional incontinence may have mental or physical disabilities that keep them from urinating normally, although the urinary system itself is intact. Placing the commode close to the bedside and assisting the patient to the bathroom are helpful for functional incontinence. And neurogenic bladder. This is a bladder issue resulting from a neural problem. Patients who are at home can use a clean technique for intermittent catheterization and change the catheter every 7 days. There is no need to use a new catheter every day, to use sterile catheters, or to take any prophylactic antibiotics. Genitourinary medications. Antibiotics that can be given: Bactrim, ciprofloxacin, levofloxacin, nitrofurantoin. Antihypertensive are given since hypertension is a risk factor for faster progression of kidney disease. It's important to keep the blood pressure under control to decrease the risk of renal failure. Studies find that E. coli is getting wise to Bactrim. It's the second most commonly prescribed UTI drug. Contrast dye. Iodine-based contrast dye is used during IVP and for many CT scans. The nurse will need to notify the healthcare provider before the procedure so that the patient can possibly receive medication such as an antihistamine or corticosteroid before they are started. Patients with impaired renal function are at risk for decreased renal function after an IVP because the contrast medium used is nephrotoxic. Corticosteroids can help with neuropathy. Steroid treatment can prevent or delay loss of kidney function. Affleed enemas are high in phosphorus. They should be avoided in patients with elevated BUN and creatinine because phosphate cannot be excreted by patients with renal failure. Phenazopyridine, pyridium, is used to treat dysuria. It is a urinary analgesic and it can change the urine to deep orange. Tap water enemas utilizes a hypotonic solution to promote defecation when a patient lies in a left Sims position.